When it comes to race and health disparities, the issues are actually quite complex. I would like to explore some common myths up front in order to set us up to more deeply integrate what we learn in this course to our understanding of racial disparities. Myth 1. Health disparities are a thing of the past. This is not true. For example, current infant mortality rates for Indigenous and Black women are significantly higher than their white counterparts. There's also still a higher mortality rate from cardiovascular disease for Blacks than whites. Myth 2. We will never close the disparities gap. Health outcome gaps have reduced over time in some areas, but still we have a long way to go. Myth 3. Disparities only appear in quote-unquote urban settings. While only 20% of the nation's population resides in rural areas, those residents comprise more than half of the geographic population centers that lack basic medical care, including more than 50% of all behavioral health shortages. Why would we then assume that disparities only occur in urban settings? Myth 4. Whites are the healthiest race. In the aggregate, Asian Americans and Pacific Islanders are among the healthiest Americans. When you disaggregate the data by ethnicity, there are a number of disparities, however. Hispanics show a 25% lower all-cause death rate and lower death rates for 9 of the 15 leading causes of death compared to whites, despite experiencing worse socioeconomic barriers. Myth 5. Health measurements for Blacks have not improved. Infant mortality rates among Blacks has dropped by more than 20% since the late 1990s, and cancer deaths have also dropped for Blacks. The purpose of exposing these myths is to point out that whites are not superior in health. It is important to distinguish that gaps in health exist not because whites have better health or Black and brown people naturally have poor health. Disparities occur due to the inequality of our systems. It is when people interact with inequitable systems that disparities appear.